Hi, welcome to the webinar, our first Bunion webinar open to the community. We are going to get started in just a few minutes, but we have some participants already here. So if you just want to sit tight, get comfortable, and we'll begin shortly. Hi, everybody. Welcome to our first community webinar. I'm Dr. Jody Schoenhaus, and I'm very excited to bring you the latest and greatest in bunion care and the advances made in bunion surgery, as well as conservative care options. We are just a few minutes shy of beginning. Thank you all for joining us. We're going to get started in about 5 minutes. So sit tight as more and more people join and log on to Zoom, get accustomed to the new technologies. So just bear with us and we'll be right there. Hi, everyone. I see more and more people are logging on. We are almost at our numbers. So I just want to give everybody another minute or two. I'm Dr. Jody Schoenhaus. For those of you who know me and those who do not, welcome to our Bunion webinar. We are going to get started in just 2 minutes. Good afternoon, everybody. For those of you who heard this before, sorry. Those of you who are here, welcome. I'm Dr. Jody Schoenhaus, giving the first Bunion webinar. In the new day of COVID, these community outreach programs have been really beneficial. Our telemedicine has been a huge success, and this is great. We have received a lot of requests for people who are now home and working and inquiring, is this a good time to have their bunions done? What has changed? So I decided to put together this lecture to inform a lot of you what has changed in the last 5 years in regards to bunion surgery, because frankly, it's been a lot, and a lot of advances have been made, making bunion surgery current and very easy, much easier than it used to be. So I'm very excited to proceed. If you have any problems hearing me or seeing me, please put in a chat or in the Q&A and I can address that. But I will answer all your questions at the end. This is meant to be informative, give some community outreach to you, introduce you to new technologies in bunion care, and that way you can decide if proceeding with your bunion procedure is right for you. So, as we proceed with the bunions, what is a bunion and what are the objectives of this lecture? So we're going to start with clearly, what is a bunion? Why do we get a bunion? What can we do to slow the growth of a bunion? What are some treatment options available? And what can I expect if I proceed with surgery? Dr. Jody Schoenhaus, a little bit of background. I went to the University of Michigan, go blue, and then I graduated from Temple University. I have a subspecialty in leg vein phlebology and do a lot of venous insufficiency procedures. I am board certified in rear foot and ankle and foot surgical reconstruction, and I am on most insurances. Here's our website where you can gain more information and certainly our office phone number. So giving you some basic understanding about the foot and why development of a bunion is so intricate. Did you know that the foot contains 26 bones and 33 joints that all have to work in beautiful concert when you're walking? There's a lot of stress and strain placed on each of those bones. That is the most concentrated number of bones and joints anywhere in the body. The crazy part is, with every step that you take through the big toe joint, you place 2 to 3 times your body weight through that joint. So imagine from 8 to 10,000 steps a day, 3 times your body weight through the big toe joint when you toe off. No wonder why we develop a bunion or arthritis or stress and strain through the big toe joint. So what is a bunion? A bunion itself is a deviation of the big toe joint. As you can see from the depiction, the big toe actually takes a curve and you develop a deviation or a subluxation of the alignment of the big toe joint itself. So why do we get a bunion? It's basic. You can thank your parents and your grandparents. It's genetic. Your basic foot type you are born with. So we develop that basic bone type and foot structure. However, it is the shoes we wear and activities we perform that will make it worse. Natural living. So let's say this beautiful depiction of the high heel shows the great high heel shoe, but if we wear that day in and day out, or even Friday and Saturday nights for years, that formation will cause and aggravate a bunion that may already be a pre-underlying condition because of your genetics to make the foot and the bunion worse. Also, activities we perform. Activities we perform will definitely aggravate it and expedite the process of aggravation through the joint, contributing to making the bunion worse. So if you dance and you're on point, or if you're in golf and you're playing golf and you're torquing off of the big toe joint in that twist, those will add to excessive forces in the big toe joint, contributing to the formation of a bunion that progresses as we age and as we walk. What can I do to slow the growth of a bunion? Well, there's a couple of things. Having the understanding that the bunion will grow with you and get worse as you age. You can slow the growth of a bunion by wearing a good old supportive shoe or a sneaker. Now, that's not to say you have to live in a sneaker day in and day out. And thankfully, sneakers right now are in and stylish. But the more supportive of a shoe that you can wear, the better it is for your foot type. Taking it one step further, you can wear an orthotic. And here, the picture you see performing a custom mold insert of the foot that is then placed into the bottom of the shoe. And the purpose of the orthotic is to control the mechanics when you walk through that big toe joint, thus eliminating the negative forces and slowing the bunion growth. We also see a picture of the splint. I often get questions, can I wear a gel insert or a splint on the foot? Well, you can, and it can help realign the big toe joint and calm down the small muscles of the foot from overworking. But it's not going to do anything to reverse the bunion. And any claims you see made online are just that, claims. So they are good to calm the muscle spasm of the foot and align it in a sneaker or at night to rest the foot, but it won't reverse the bunion. All of these can slow the progression. Let's talk about flip-flops for a little. Havianas are adorable, but wearing a flimsy flip-flop is essentially like going barefoot and is terrible for your foot. When we're in the summer sun, it's best to wear a supportive sandal like a fit flop or Birkenstock. Make some really cute ones. Definitely get some for the home, Bionic, some Skechers. They make some good fashionable sandals with an arch support is better than the Haviana. So let's talk about the severity of a bunion and breaking down your understanding of bunion correction. So the first is a mild bunion, where the big toe might start moving towards the second toe. You may get a little deviation and a little bump on the inside of the foot. Next is moderate, where that bump is a little bigger and that big toe is really now abutting or touching the second toe. Finally, severe. A severe bunion is when the big toe joint is really dislocated, and the second toe actually begins to cross over the big toe. Once you're in the severe category, it is something that you want to consider to fix. It is a little bit more intricate of a fix, but if you don't do it now, what can happen at the point when you're 80 or 90 years old, it makes fixing it A, that much harder, and B, that much more difficult to heal just because of your natural age. So now we're going to talk about that second toe crossover because it is extremely important. The second toe crossover is something that you want to look at that can help with the severity of your bunion and understanding. So with the big toe, when you have a bunion and you're walking, this is the first toe and it lifts up a little bit. Afterwards, what you're happening is you're putting all the stress and strain under the second toe. As you continue to walk and increase the load on the second toe, that joint starts to dislocate. You can tear the ligaments and the tissues that hold it in place. So the second toe starts to cross over on the big toe. You see a picture on the bottom where you can splint that second toe in place and tape it. And that is ideal if you're going out for the night or you're wearing tight shoes. You want to tape it and splint it in place. Feel free to contact our office. We have that written out and a picture of showing you how to splint it in place, and that will really help. Once the big toe does cross over the second toe, you know that you have a severe dislocation. Believe it or not, in patients who are over 90, the treatment of choice to prevent irritation and skin breakdown of the second toe is an amputation. Quite extreme in a young patient and not recommended for anyone on this webinar today. However, once you get to that age and you're at risk for wounds and infections, believe it or not, amputation of the second toe can occur. So it's advised to fix it in advance. Other conditions can be associated with a bunion. You can get a curved toe called a hammer toe, and it's really where the toe starts to do this and curve. And on top of the toe, you can develop a corn or a callus as associated with the top photo. Corns and calluses occur and they can be painful. The skin gets thickened and can cause a lot of ball of the foot pain. Other conditions can include a neuroma, which is a sharp shooting sensation where you can get a stabbing and burning, shooting pain to the toes. You see on the picture on the bottom where you develop a callus on the ball of the foot. Conservative care for that includes scraping it down, the use of an orthotic or a pad in your shoe, or a procedure called fat pad restoration. What are the various treatments for bunions? So now we're going into our options, and they include either conservative or surgical care. It's very black and white. Conservative care includes orthotics, change in shoes, and splinting of the toe as discussed. Keep in mind the bunion will get worse over time. Surgical care is something that can be done. It's outpatient, takes about an hour to 2 for the full reconstruction under anesthesia, so you have the best nap ever. But if you're questioning, is surgery right for me? There's always 3 main questions I ask my patients in a consultation. 1, does it cause you pain on a daily to weekly basis? 2, is it interfering with the shoes you want to wear on a daily to weekly basis? And 3, is it interfering with the activities you want to perform on a daily to weekly basis? If you can answer yes to 2 out of those 3, surgery is right for you, because it will just get worse over time and you will never be as healthy as you are today. So surgery would be right for you on 2 out of 3. Now comes the question about aesthetics. What if you just don't like the appearance of a bunion? And there may be some people on here who have that concern. If you're utterly embarrassed, you're hiding your feet in the sand, I can understand that. Come in, we'll talk about and measure the pros and cons. I have done it for cosmetic reasons. It is accepted and appropriate. but let's make sure it's right for you. So now that you've decided if surgery is right for you, let's talk about the progress that has been made in surgical care. So what can you expect? Pre-procedure, surgery, and post-procedure. Pre-procedure, you have your history and physical examination. That is done in the office with a bunion evaluation and x-rays that are performed weight-bearing in our facility. You have pre-procedure blood work and labs, just making sure you're healthy enough to undergo the anesthesia and the recovery process. Then it's surgery. It's an hour to 2. Essentially, you have an outpatient procedure in the surgery center. You have an IV put in your arm. And then when you come out, you have a splint on your leg and you wake up in the recovery room. It's a very private setting that during the time of COVID is even very careful and cautious. I'm trying to do these procedures in an ambulatory center, so it's extremely private with just you and the OR staff, all masked and gowned with COVID precautions. Everybody's temperature is taken, and it is in a clean, sterile environment. So if you're concerned about COVID, believe me, we are doing all appropriate COVID testing and taking necessary precautions. Post-procedure protocol. And this is something that is really important for you to understand. For the first 2 weeks, essentially, you want to be home and elevated. The more elevated you are for the first 2 weeks, the easier your long-term recovery would be. Toes above nose is what I like to say. You can use ice. I will give you oral medication for pain. And certainly, you can put mild pressure on the splint or the shoe. So you can get up to go to the bathroom, make a sandwich, things of that nature. I see you in the office at 1 week, and any stitches come out after 2 weeks. The key here is elevate, elevate, elevate. Now, the healing times vary depending on the severity of the bunion procedure, and I'm going to get into that now. One thing I really want to note is the key to doing the right procedure the first time. So if you've had a previous bunion procedure, or you just say, can't you shave my bump? The answer is no. You will have a recurrence of the bunion. So we want to make sure that you are addressing the bunion in the right place at really the epitome or the base of the deformity. And that is something I evaluate clinically on an x-ray. So as you can see, this patient came to me. She already had surgery. You can see the scar. She just had the bump done, and we had to go in and fully reconstruct because the appropriate procedure wasn't done the first time. These advances have made bunion surgery so much easier. And why are we having these advances? In the past 5 years, a lot of research has been done from feedback from historical and traditional bunion surgery. So traditional bunion surgery, you've heard, it is the worst, it's so painful, the healing was forever. Well, in order to ameliorate that or decrease the problems that traditional bunion surgery has had, surgery advances have been made. Decreased pain, decreased healing times, decreased swelling, and decreased rate of reoccurrence, with a faster return to activity and overall improvement of quality of life. So there's 2 main techniques that have been advanced. One is called MIS, minimal incision surgery, and that is best reserved for people who have mild to moderate bunions. And then 3D bunion surgery, and that is done through intraoperative bunion correction and reserved through moderate to severe bunion surgery. You may have heard the terms in-core or Lapiplasty performed. These are the common 3D corrections. So, as I was saying, historically and traditional bunion surgery, 8 to 10 weeks before physical therapy, a lot of stiffness of the big toe joint, delayed healing times, a lot of pain, and now we have more immediate weight bearing. Swelling is only lasting just a few months. Pain is controlled through minimal surgical dissection. You have more motion at the big toe joint, and therapy, if needed, is after 4 weeks. It's really cut the healing time significantly down. So let's look at some mild bunion corrective cases. So with a mild bunion, you have new advances of minimally invasive procedures. And why is this taking place? Because with this, believe it or not, you can correct the bunion without actually entering the big toe joint, which has been really beneficial. Faster healing times, a lot less swelling, minimal scarring. You can walk and be almost in a shoe after 2 weeks, and certainly by 4 weeks, with full return to activity by 8 to 10 weeks. Now, healing times may vary, but a significant improvement from traditional bunion surgery. Now, here's a great case, minimally invasive, showing pre-op and then 1 week post. Minimal swelling to the foot. The black line that you see is my intraoperative markings, but you can see on top of the foot between first and second toes is just that line. And that is with absorbable sutures intact. And that's after only 1 week. This patient was able to walk after the week, and she came in my office literally in a sneaker after 3 weeks. Here's some other hidden scars. So there was a scar put on the inside of the foot, so you don't see the scar at the bunion site. Unfortunately, the second toe did start to cross over, so it had to be addressed, and you see a little bit of swelling, but certainly this is a short time after, and within a 3-month period, the picture was taken. So there's still some healing and decreased swelling that has to occur, but significant improvement of scarring. Moderate and severe bunion correction. This is significant in doing the right procedure at the apex of the problem at the right time of surgery. So what is 3D bunion correction? It's essentially taking your traditional bunion that is done at the joint and moving it farther back where the deformity exists. So let's say you have my elbow and the big toe. So normally the procedure was here to straighten, but the problem really is now being addressed by straightening the apex, like the Leaning Tower of Pisa analogy, to bring it back into full alignment and obtain long-term correction without having a reoccurrence. Here is a video depicting that on the operative table. So you can see a pin in place, and the hand is going to move the bunion into correction on the table itself. So I'm going to show that again. You see the two bones at the tip, at the end of the joint will realign under the joint through a 3D animation in the OR. Oh, I'm going to do it now. It's pretty impressive. Once it's obtained, that corrected position is locked, and then plates are in place. So you can see the correction. This procedure happens to be called a Lapiplasty, and it was performed with alignment corrected at the apex. And you can see now the big toe is straight. This was another 3D correction done with an in-core system. The advantage of the in-core system is that you don't have plates that are prominent, and you don't have anything that you feel on the outside of the skin. Both have great long-term outcomes. Here's some more before and after photos of moderate bunion correction with the hammer toe, nicely aligned. She just needs to have some swelling come out and a good pedicure. Here's another case example, overlapping second toe, addressing, that's a little bit more of a scar, 6 weeks after the correction of the bunion. When you have a correction that is in more moderate to severe, the scarring will take slightly longer. If it's a concern to you, we can perform laser scar reduction or use over-the-counter scar remedies. Essentially, it takes about a year for full scar remodeling, but once it has, the scars are barely visible. More moderate bunion correction with the crossover. As you see, the post-procedure is really well aligned, and you can see the hammer toe repair as well. Again, this is just about 2 months post-procedure, so the scars still have a lot of healing. The scar on the second toe is one of my favorites to do because once it fully heals, it's in line with the joint itself and barely visible. Another great correction of a severe case, this is 8 weeks post-correction of the crossover second toe with good alignment. So as you see, those are some case examples talking about conservative care, moving into new 2020 management of new minimally invasive techniques that get you back on your feet faster, back in shoes earlier, causing less post-operative pain. And I would say, any way you cut it, it's about a 3-month total commitment for a lifetime of an active, pain-free, healthy living with beautifully aesthetic feet. So let's open up to some Q&As at this point. And I love the Q&A session, question and answer, because it really sparks some good conversation. I did a webinar this morning and I got really good questions. I'll start the Q&As, things that people asked me this morning. And as I do that, I'm going to encourage you to ask more questions. So, basically, first question that was asked of me today, is physical therapy needed? Physical therapy, it depends on the person. If you're typically under 20, let's say, then I can see you not needing physical therapy, and if it's mild to moderate. If you have a severe bunion and you've been walking and now we're doing reconstructive surgery, certainly we're going to have to train our feet to walk again. And for that, you just may need 2 to 3 weeks of physical therapy to increase your strength and range of motion. One question I got was, will my bunion recur over 20 plus years? And this is very important. If the right procedure is done for the severity of the bunion, it should not recur. Now, some traditional bunion techniques, we are seeing bunion recurrence long-term. But with the newer advances that have been studied, and we're getting really good long-term results now, the bunion recurrent rates are much lower. So if you had bunion surgery 20 years ago and it's recurring, or even 15 or 12 years ago, you may have a slight recurrence. But if you're going with the new techniques, your bunion recurrence rates are much lower. So let's see that raised hand. At 60 and in good health, how long before getting back to running and long walks for exercise? I would say if you have a mild to moderate bunion, you're back to good activity by 8 to 10 weeks. Severe bunion correction, 10 to 12 weeks. Let's make that a full 3-month commitment, so 12 weeks. Really, the more you dedicate to elevation and healing the first 2 weeks, the quicker your long-term recovery is. So short-term commitment gets you back on your feet faster and healing quicker. So those were some 2 great questions. Does anybody else have any other questions? Somebody this morning asked, if I have a mild bunion and it bothers me a little bit, should I have it corrected now or should I wait into the future? Keep in mind that bunion procedures or bunions will continue to worsen over time. So it may be beneficial if it's bothering you a little bit now to have it fixed. The other thing is, when are you going to have the time to dedicate? So if you're in that mild phase and you're working from home now, it could be a good time to have it fixed because you can have it done. I do my surgeries on a Friday and have that computer on your lap with your leg elevated for healing by Monday. So you're still in your post-op course, but yet you can still work because most people are working from home. If you have a mild bunion, but it's no pain at all, then I would leave it alone and just consider conservative care with the use of an orthotic. It's interesting. Some people could have the worst bunion, severe, with absolutely no pain or interference with activities. Some people can have a mild bunion and have significant problems. It's very patient independent. So it really depends on the person. So these are some great questions. Keep them coming in. I had those 2 questions and I really love this part. Anyone have any comments, questions, anything that they've heard of, any myths that you may have heard of that we can debunk or support? I love these webinars because it really gets everybody thinking about their own situation, their own feet, and then you go online, you could Google something, see what's the latest and greatest out there now. So another question, thanks, keep them coming. Do women get them more than men? Awesome question. Yes, and that's naturally because high heel use and the shoes we try to get into. With men, it's that category of heredity and activities. Unless you're a man who wears high heels, no passing judgment here, that's fine. But most often it occurs in women more than men because of the tight fitting shoes that we like to get into. Great question. Not only that, I will say, women go through childbearing ages. And when you have children, progesterone and hormones as we age will increase, as well as make the soft tissue structures of the foot more lax. So as we get older as women, our feet loosen or splay. And that too makes getting a bunion, you know, a little bit more inherent for a female. Great question. Anybody else? If there's no more questions, I thank you for attending the webinar. The purpose of today was to be informative, answer any questions that you may have had, get your own thoughts rolling, and if you are interested, we can have a consultation and decide if the procedure is right for you. Thanks, everybody. Have a great night. Stay safe and healthy.